Welcome back. You know, some really frightening and concerning statistics for expecting moms, particularly Black women. According to the CDC, Black women have the highest maternal mortality rate in the United States. In 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births. For white women, in contrast, it was 26.6 deaths per 100,000 live births. Now, when it comes to babies, the United States has a concerningly high infant mortality rate as well. In 2020, the CDC reported 5.4 deaths per 1,000 live births. So the big question is, what can be done to save lives here? Well, joining us this morning, we have Married to Medicine star Quad Webb joining us. Thank you so much for being with us.
How are you?
I know you got a lot of fans who are so happy to see you on TV this morning.
Okay, good morning.
And we also have the pleasure of, first of all, I want to mention that you have a new role as the face of the Neonatal Intensive Care Unit for Millennium Medical Group. So congratulations on that. And we also have with us Shon Parson, who is the lead neonatal nurse practitioner for the Millennium Medical Group. And you know, it's so important that you're here to talk about this issue. It touches so many lives. We were just talking off camera. Everybody has, you know, a mom, a sister, a daughter, some woman in their life who could be impacted by this. I wanted to start, Quad, by just asking you, you have a personal connection that made you passionate about this.
Yes, and every time I talk about this, and Shon has been with me for months now, and every time I talk about this, I fight back the tears. But it's very important to me because I have seen the true benefits of the NICU. When the NICU is giving total care. I have two close family members. In fact, I'm becoming a relative foster parent now. And one of those children, they are a product of the NICU unit. Yes, so it's great.
Well, congratulations on being a relative foster parent as well.
I'm excited.
So, Ms. Parson, I just want to ask you, you know, it's so troubling, these statistics that we're seeing, particularly when it pertains to Black women. What's the reason for all this?
So what we have noticed is a lot of times with our Black moms, they don't seek the proper prenatal care that they need prior to giving birth, and that's for various reasons. And what we're trying to do is educate them on the importance of getting prenatal care, because it not only saves their lives, but it also saves their babies' lives.
And I want to ask you also, you know, unfortunately, we've covered some other issues surrounding all this, things like disparities in terms of health care.
Sure, absolutely.
Healthcare deserts, things like that. So how much does that play a role?
A tremendous amount. Sometimes people don't get the proper prenatal care because it's just the distance between where they live and where's the next healthcare provider. Another part of that is often African American women don't feel like we're being heard. It could be something as medical racism or bias or even just being inattentive. And so when you feel that you're not empowered and you don't have any power and you don't have a voice, you kind of just go for whatever they're telling you. But what we want people to know, and most importantly, what I am pushing is the message that you are powerful. You do have a voice. And we have to start making our healthcare providers more accountable for their actions. Let's just say, for instance, if I'm going into a hospital and I'm saying, hey, I would like to have these particular tests done. Sometimes due to our insurance, it's like, oh, well, no, we're not going to give that person. You don't need that. You don't need that. And if you are faced with that, then it's simple to say, you know what? Tell me why I'm not receiving that particular test. I also want you to document it, take it down to medical records, and I'm going to be requesting a copy. Whoa, what does that do? That puts it, that puts that healthcare provider on alert, like this could come back on me. And so you want to kind of say, listen, I'm a real person, I matter, and my prenatal care matters as well as my neonatal care.
And be your own advocate.
Yes, you have to be.
And as a medical provider, we want women to take initiative about their health care. We want them to be empowered to say, you know, this is not right. What can we do? How can you help me? And so that's why we're taking this initiative to educate the women that you have a voice, and we want you to seek the proper care, and we're here to assist you with that.
Yeah, I mean, definitely it's so important. And you know, you're talking about, you touched on this issue of, you know, what many people call medical racism. And you know, I think that what we've learned in the last few years is kind of about disproportionality in terms of research. What do you have to say about that?
Well, there is a disproportionate amount in the research, especially with our Black mothers. We are out of 100,000 live births. Black mothers are 70% of Black mothers have death giving birth, okay? Those are the statistics. Compared to our white moms, the numbers are like 26 to 27%.
Yeah.
So there's a big disparity there.
Yeah, so you have to be your own advocate, like you said. But beyond that, what else can moms do so that they put themselves in the best possible position, not just for themselves, but for their babies?
Right. So we're always going to encourage prenatal care. We're always going to be pushing that. That's the first mission. Even if you had not had prenatal care with other children early in other pregnancies, if you're pregnant again, each time is a new time. You want to be able to early detect things, which could possibly save your life and also the child, the baby's life as well, right? So yeah, I think prenatal care is most important.
Prenatal care is very important because a lot of times moms are at high risk and don't even realize
High
it.
blood pressure, hypertension.
Yeah, gestational diabetes. And so we want to identify these things early so we can put them on high risk. And so when they come in, we will know and we can get them the proper care.
All right, well, thank you so much.
If I could just squeeze in one little thing, it's so important. I just want to say thank you so much to Southern Regional Medical Center. They're doing some amazing things down there on the south side. Recently, we just did the ribbon cutting for the new OB-ED. This is amazing. I say that because if you are pregnant and you're going into traditional ED or ER, you may have to be there for a number of hours. We don't know. But at Southern Regional Medical Center, they said, you know what? If you are with child, we now have a new OB-ED. So I just wanted to be able to put that out there if you're here in the Atlanta area.
Well, thank you so much,
Yes.
Married to Medicine star Webb, for joining us, and nurse practitioner Shon Parson. We really appreciate your expertise, your advice, and we're going to post this interview online at AtlantaNewsFirst.com so people can get more information.